Assalamualaikum everyone. Myself, Dr. Numan, and I'm working as a medical advisor at Gets Pharma. I hope that all the audience that we have today is safe and doing well during this lockdown situation. Why we are here, the purpose for being here today is, as you have known that just few days back we did a session with ISUOG regarding the management of a pregnant woman with COVID-19. Continuing that series, again today we are here with ISUOG and we have Ultrasound Society of Pakistan on board with us as well. काफी ज़्यादा questions जो हैं during उस session आ रहे थे regarding what should be the advice to the patient regarding the antenatal visits. Antenatal visits का number कम होना चाहिए या should they be continued in the same number or not? And what could be the precautionary measures that can be taken while doing ultrasound? So it's quite important to keep our workforce safe as well because we are the service provider. If we won't be keeping our workforce safe, ultimately we won't be able to provide services to the patient. And right now, as a nation, I would say हमारी nation बहुत जल्दी panic कर जाती है, and that's what the scenario right now is. बहुत ज़्यादा panic के अंदर है, and I think जो patients antenatal visits के ऊपर इतने regular नहीं भी आते थे, वो भी current situation के अंदर regarding with a lot of questions जो हैं वो SCP के पास present हो रहे हैं. To discuss all these things, we have an expert panel today. Session moderation will be done by none other than Dr. Sadia Hassan, and उनका introduction I'll be giving, and then later the expert panel can actually introduce themselves one by one. And Dr. Sadia के मुतालिक मैं बताता चलूँ, she is working as a consultant obstetrician and gynecologist. She is a medical director at Concept Fertility Center, Karachi. She is also the chairperson for Maternal and Fetal Health Committee. So, ma'am, I'm gonna hand over this session to you, and you can have the start with the introduction of all the expert of panel, and then later discussion on the topic as well. So, Assalamualaikum, ma'am. Can you hear me?
Yes, I can hear you, Dr.
How are you?
I'm good, thank you.
So you have the floor now. You can start with your discussion.
Okay. So this is a very important topic that we are covering today with the Ultrasound Society of Pakistan, and we have an eminent panel. Dr. Shama Munim, who's professor of OBS at Jinnah Medical and Dental University. She is also a fetal medicine specialist and also works at South City Hospital. She will be starting the presentation, this session with her presentation, and then we have our panel of experts who will be giving their inputs as well. We have Dr. Shahida Zaidi, who's the director of Ultrasound Clinic. She's the patron of Ultrasound Society of Pakistan, and she's also the past president of Asia Oceania Federation of Obs and Gynae, and as well as being the past vice president of FIGO. And we have Dr. Mussarat Hassan, who is a consultant ultrasound specialist. He is the CEO of Ultrasound Society of Pakistan, co-opted counselor, Asian Federation of Ultrasound in Medicine, fellow member, American Institute of Ultrasound in Medicine. And our third panelist is Dr. Tanveer Zubairi, also a renowned radiologist. She's a pioneer in ultrasound, author of the Atlas of Pediatric Ultrasound and Ultrasound 1, first, second, and third trimester. So I will request Professor Shama Munim to start with her presentation. Thank you.
Thank you very much, Professor Sadia for that kind introduction. And without wasting much time, I'll move. I would like to thank the organizers for giving me this opportunity to present this much needed topic. You know that the COVID-19 has posed us with many unprecedented challenges, and the main aim for us is to control the spread of infection, as our understandably our infrastructure cannot cope with the burden of this disease, and we can only control this by avoiding unnecessary exposure between the potentially infected worker and potentially infected patient. And above all, we need to prioritize our medical staff and resources for the COVID-19 response. Now, particularly all those of us who scan are vulnerable to develop problems because of our close proximity between us and the patients. Some of the scans like anomaly scan, fetal echo, and invasive procedures can take more time, and many of us allow attendance into the room, and therefore there are more people in the room, and above all, there is an enclosed space. So basically, we can mitigate these risks of during the ultrasound is by prioritization and rescheduling the ultrasound, screening the patients attending the ultrasound, and taking precautions in the waiting room and the examination, and guidance of the staff undertaking the routine or special ultrasounds and visits. So by rationalizing the service, our aim is to reduce the minimal and have minimal hospital visits until absolutely necessary. And before we do that, the International Society of Ultrasound of Obs and Gynae, ISUOG, has actually developed a guidelines whereby they recommend that you ask the patients the standard questions, which is called TOCC, travel history, occupation, clusters, and contact. Now that the travel history with the lockdown and everything may not be that important, but it has to be highlighted. The idea is to know from the patient if she's suffering from any upper respiratory tract symptoms, and to highlight the patients that have potentially, that can turn out to be a potentially COVID patient. Now, the approach to the types of scan can be categorized like the cesarean sections into red, orange, and green. The red are those scans that have to be done without much delay. Those that can be delayed for a little while can come into the orange category, and those that can be cancelled during the whole duration of the pandemic appears to be green. Similarly, the patients that come for the obstetric ultrasound are the vast majority of our bulk patients are low asymptomatic patients, which may be positive or negative for TOCC. Then we have a third of patients that have pre-existing or emerging comorbidities like diabetes, hypertension, previous bad obstetric history, and they are asymptomatic with your TOCC, and lastly are the ones that are the COVID patients. So what I have done is I have categorized these into low risk, intermediate risk, and high risk, and then I'm going to focus on the obstetric recommendations while Dr. Shahida Zaidi will address the issues with the gynae prioritization. Now, in terms of the ultrasound scanning, we all do three major scanning: the nuchal translucency, which is done between 11 weeks and 13 weeks and 6 days, anomaly scan, and growth scan. For the low risk asymptomatic patients, we can go ahead with the nuchal translucency and the anomaly scan. Mainly, we have the window period. For NT, we have 2.5 weeks window period, and for anomaly scan, we have 5 weeks window period. But the growth scans during the pandemic have to be postponed or cancelled altogether. Then you have the low risk symptomatic or those with a positive screen for TOCC. They don't need to have an NT scan. You can offer them non-invasive prenatal testing or the NIPT, or else you can actually bring them back if they are within that window period after the quarantine. And similarly, you can do the anomaly scans, and again the symptomatic low risk patients have to also cancel all the growth scans. In terms of your patients with pre-existing comorbidities, this group contains high-risk patients, advanced maternal age patients, and therefore you would do NT scan in the asymptomatic along with anomaly scan, but you would reduce your frequency of growth scanning, because many well-controlled diabetics doesn't need to come every 4 weeks during the pandemic. You can postpone it for 6 weeks, provided your situation allows you to do so. So generally, the growth scans can be individualized in this period. In terms of symptomatic patients with or without TOCC screen, they don't need to have an NT scan. You can offer them an NIPT or reschedule after quarantine. Similarly, you can do the symptomatic patients if the growth scan is required after the quarantine period, and so is the anomaly scan. Moving on to your COVID patients is a different scenario. And you have COVID patients that are monitored outpatiently and those that are hospitalized. For those that are hospitalized is easy because you can perform a bedside ultrasound on both these, provided you take care of the gear that you wear and all the precautions are taken in terms of cleaning the machine, and that we will talk later. But often the problem is in the bedside scanning is the level of equipment is not that brilliant. And many of the COVID patients are known to have fetal growth restriction, so you would need to monitor them, but with precautions. In terms of outpatient COVID patients, you can skip or cancel the nuchal translucency scan altogether, offering them an IPT that they can get the blood test done from home. And if within the gestational window period, you can reschedule in 2 weeks. Similarly, the anomaly scan can be rescheduled in 3 to 4 weeks. And as I've already highlighted, that the frequency of growth scans can be reduced between 28 to 34 weeks of gestation. This is something that I thought is worth mentioning, and it's the ISUOG guidelines along with MFM, and they have been published last month for this pandemic, and they aim to maximize prenatal diagnosis, and their aim is also to minimize exposure. Therefore, they have recommended that we combine dating and NT scan, because many times we do a dating scan earlier on in pregnancy, and they recommend that if for some reason pain or bleeding, if the first trimester scan is done, you skip the NT scan. And for those where the LMP is not known or gestation is beyond 14 weeks, to do an early anomaly scan between 16 to 18 weeks, or else you do the next available scan, which is the anomaly scan. Now, for anomaly scan, the careful consideration is to call the patient as late as it is practically possible, so that आपको ये ना हो कि कोई चीज मिस हो गई या हार्ट नहीं देखा या फेस अच्छी तरह नजर नहीं आया, and then you want to call your patient back. Instead, you call them at 21 weeks if that is possible, and if at that detailed anomaly scan you cannot see anything, then you would reschedule for the rescan in 4 to 8 weeks rather than 1 to 2 weeks. And similarly, the anomaly scan for those with maternal body habitus BMI above 40, you need to call them after 22 weeks of gestation, and there is no role of serial cervical length screening during the pandemic. In terms of growth scan, all singleton pregnancies can have single scan at 32 weeks, and those that want a follow-up scan for low-lying placenta, it can be delayed to 34 to 36 weeks to ensure that you would know what is happening. Now, this is something that I really like, and this is what I'm going to end on, that this is the recommendation that you combine your OB visits with ultrasound and other things, so your patient doesn't have to come again and again. So those that are less than 11 weeks of gestation, you do a teleclinic, tell the patient that ask them and give them folic acid and calcium, और उसके बाद आप 11 to 13 weeks पे उसको in person भी क्लिनिक में विजिट कर लें, एंटी भी उसी वक्त करवा लें, और एंटीनेटल लैब्स भी करवा लें. And then your next visit can be at 20 weeks doing the anomaly and your antenatal visit. Similarly, the recommendations are that beyond 20 weeks, instead of seeing everybody every month, you can see every 2 weeks. You would see from 28 weeks every month till 36 weeks, and from 37 weeks, understandably, you'll have to see every week. Now, the aim of the 28 weeks follow-up would be to see them in person, along with doing OGTT and hemoglobin and tetanus. And similarly, 32 or 36 weeks, the ultrasound can be done. So I'm not going to spend much time on the specialized scanning. You have to prioritize. If that's a monochorionic twin pregnancy, maybe you'll have to bring them back. Dichorionic, not so much. Fetal echo, there is a place of limited services because it understandably takes longer, and the invasive procedures due to time constraint have to be done. The cervical assessment by cervical length has to be performed after explanation. We call a lot of patients for CTG, and that has to be curtailed as well. And genetic counseling has to be done by telehealth. And so, in conclusion, it is a rapidly changing and highly variable state without any consensus-based guidelines available. Sonographic examination carries an inherent risk, and triage of the patient on the local population and patient risk will minimize and shorten the exposure, and adherence to safety policies will help you. Thank you very much for your attention.
Okay, thank you. Thank you, Dr. Shama, for a very, very useful and timely presentation. We will have questions in the end for you as well. Right now, I will request Dr. Shahida Zaidi to tell us about recommendations for gynecological scans in this time of pandemic. Thank you.
Just a minute, I'm waiting for this.
Yes.
Oh, okay. Oh, okay. Thank you, Sadia, and thank you, Shama, for an excellent presentation. Now, as she mentioned, the International Society of Ultrasound and Obstetrics and Gynecology has compiled guidelines both for obstetric scans, which she mentioned, and also for gynecological scans during the crisis of the pandemic that is raging now. And they advise that in this scenario, we should check as to whether the patient needs an ultrasound immediately. And this was also common in the obstetric scan. You have to find out as to whether she needs an ultrasound without delay, that is now, or we can delay the ultrasound for a few weeks. That means it should be done soon, but not immediately. And those in whom it can be delayed until after the epidemic, that means we can postpone the ultrasound examination. Aage, not working? Yeah, karke dekhiye. All right, never mind, I'll continue speaking. All right, okay. Now, the International Society has also issued a list of indications that can be performed in these three categories of patients. Under the category that an ultrasound scan should be done urgently, without delay, that is, they have mentioned, first of all, acute pelvic pain and acute pelvic pain which is persisting, and you suspect that an ectopic pregnancy might be present, or a twisted ovarian tumor, or a rupture of an ovarian tumor, or there might be pelvic inflammation that needs to be dealt with. And here in pelvic inflammation, there might be symptoms such as fever, which are common to the viral infection. Therefore, you have to screen this particular patient extra carefully. Then in the second group of women, they have mentioned that any complications that occur after an operation or after you have carried out or somebody else has carried out a procedure, they also need to be dealt with on an urgent basis. Then they mentioned that the ovarian stimulation syndrome, hyperstimulation syndrome has been mentioned, but I think we are all agreed that in these times of crisis, all assisted reproductive procedures should be done or deferred until the epidemic is over. And then fourthly, they consider that a mass which is present either in the pelvis or in the lower abdomen, especially if it is accompanied, as I mentioned, with pain or with additional symptoms such as abdominal distension due to ascites, and this could be due to a malignancy, and therefore this also needs to be dealt with on an urgent basis. And finally, they mentioned that heavy vaginal bleeding, especially if it's accompanied by symptoms such as severe anemia, those should be dealt with. Because if there's heavy vaginal bleeding, but there's no anemia, that means she can be tided over during the crisis by giving medication. Now, in the second category of soon, patients needing an ultrasound soon but not immediately, they have mentioned first of all postmenopausal bleeding. Now, I would say that this particular category of women with postmenopausal bleeding should also go in the first category, because in our situation, we might find that a patient who has a malignancy, for example, may not return for a scan when you schedule it later. So I would really say that if the patient comes to a gynecologist, then she should have a pap smear done then, and then referred for a scan for assessing the endometrial thickness to exclude endometrial cancer. And the rest of the indications for a scan, which is not immediate, are given in the following two slides. And these are a long list of patients who can be deferred until after the epidemic is over. And the list is given here and is also published in the recommendations which were published by the International Society. Next, please. Right, and this continues. So these are all indications which are not urgent, which can be deferred until after the pandemic. Okay, now finally, I would just like to bring out the difference between the women who are referred for an ultrasound examination to a hospital department or ultrasound room, or to a standalone ultrasound clinic such as mine is. And generally, the patients who are referred from the hospital are generally patients with an emergency, or their gynecological emergency, or from the labor room. And there is not much opportunity for scanning or screening these patients for any possible COVID infection. And the risk, therefore, of transmission from the patient or from the doctor to the patient is much higher in these patients than it would be in a standalone clinic, where you have the opportunity to see patients who are more routine, generally speaking. And in fact, if the patient has an emergency, if has a complaint, one of those 4 or 5 conditions that I mentioned earlier, then they would rather go to the hospital, where they'll be able to be seen by a gynecologist, be referred for a scan if necessary, and then an invasive procedure, if that is required, can also be carried out there. Or expert advice would be available as to whether or not an invasive procedure or an operation is required, and it can be done there and then. But they would not be referred to a clinic such as mine, ultrasound clinic. But here, during this crisis, ultrasound appointments generally are given on telephone by a person who is trained to ask as to what the symptoms are, so that it can be decided as to whether that particular patient needs a scan now or it can be deferred. And also she has the opportunity to ask as to whether she has any symptoms which could be due to the viral infection, fever and cough. And if that is so, then she can be advised to see her doctor first before coming to for a scan. And facilities may not be as good in our standalone clinics as they are in hospitals. So I just wanted to bring that out, because in the last 3 weeks or over 3 weeks that we've had the lockdown, I've only opened my clinic 3 times. And I only saw one gynecological patient who was bleeding heavily and in whom I had already diagnosed a polyp, which was probably responsible for the bleeding. And the rest of the patients were all obstetric scans. But none of those obstetric scans needed to be scanned right away. So the urgency in our situation, in our clinics, is not as great as in those patients who attend a hospital ultrasound department, a hospital OPD or emergency room, and are then referred for an ultrasound scan. Right. Thank you.
Thank you, Dr. Shahida, for an excellent presentation. I will now request Dr. Mussarat Hassan to answer a few queries that are coming up, and you can answer them together. How can clinics be streamlined, and what measures can be taken to mitigate the risk of infection? And what precautions should healthcare professionals take in these clinical surroundings? Dr. Mussarat.
All right, Bismillah ar-Rahman ar-Rahim, in the name of Allah the Gracious, the Most Merciful. Good morning, everyone, and thank you, Getz Pharma and the SOGP and Ultrasound Society of Pakistan for arranging this awareness program. My practice is my message to all of you. And coming to your point, I have some points noted down. Number one is that reduce the number of patients during this COVID-19 epidemic or pandemic, and restrict the patients only those attention. This means that the emergency ultrasound, there is a whole list of it, and one can jot down that list, as already previous two speakers have already said. And it is the duty of the obstetricians and gynecologists to assess whether this patient needs an ultrasound at this time or can be deferred at the later stage. So we always get referral patients, and we are avoiding those patients, they just walk in. Those patients who require more time and detailed scanning should be scheduled at a later time or date, as we all know that the patients like anomaly scans and color Doppler, they would require more time in assessing the problems. The next is that we protect ourselves and we protect the staff working with us, and also protect the patient as well from any infection. And I always say that we should also avoid cross-infection, because that's something which has to be taken into account. Now, there are safety measures which should be taken at the clinic or the hospital setting. Number one is avoid overcrowding at your clinic. So what we do is we make patients sit with a gap of 2 chairs. And number two is that we check the fever outside, so that if there is anyone, then we be careful about that patient as well. No patients attendants are allowed in the scanning room. In fact, we also discourage in the waiting area as well, because that can create problem for us. Doctors and their staff are wearing the mask for their protection, and the doctors can wear the gloves or wash their hands with soap after seeing every patient. Washing hands with soap is better than sanitizer, although we have sanitizer in every room. So if the patient is not wearing any gloves or any attendant is not wearing any glove, we make them use that sanitizer. But the best thing is to go with the hand washing. Using high quality gel, I always use Parker Ecosonic gel, which has a lot of alcohol content in that solution, which is safe for the patient, safe for the probe, and safe for the doctor as well. Now, cleaning the bed, we always clean because all the beds are Rexine. We have two options. One is that we use the antiseptic solution, usually Dettol mixed with water, And then we can clean the bed after every patient. That's one. And number two is that we can put a disposable sheet which can be disposed of after using on every patient. We also, in our center, we do the mopping of the floor with antiseptic after every 2 to 3 patients. And we avoid unnecessary counseling as well. If the patient needs counseling, then we tell them to get in touch with us on phone and we can discuss in detail on the phone. Probe is cleaned with the Protex solution after every patient, which comes with wipes and spray. If you leave that spray on that probe, within 15 seconds to 2 minutes, all the bacteria are killed, and that's very safe. Healthcare professionals should change their clothes when going home, and advisable that they should go for a hot bath. And if not possible, then they can also do a nice wuzu, which is much better. Table, chairs, doors, handles are constantly cleaned at our center so that we avoid all those problems. We should try our level best to protect ourselves, our staff, and our patient as much as possible. But the best protector is our God. Nature is very kind to us. By serving the humanity, we develop immunity, which in turn help us. So in the end, I would just say God bless all of us who are dealing with these patients in this pandemic time. And we hope we are all safe and things are going to be all right in the near future. Thank you very much. Over to you, Dr. Sadia.
Thank you very much, Dr. Mussarat, for a very practical rundown on how to manage in these difficult times. I will next ask Dr. Tanveer Zubairi about how can we prepare the ultrasound room and disinfect the probes and the machines for our patients and ourselves.
Assalamu alaikum. Thank you very much, Gets Pharma, to invite me for this session. Just now, Dr. Shama and Dr. Shahida has spoken about the safety of the patient and that they should be, only the emergency should be dealt with in gynae as well as in, and guidelines also say the thing of the International Society of Ultrasound and Gynecology and Obstetrics. But we, as Dr. Mussarat said, we are sitting in a clinic and outpatient clinic, and we don't know when the patient comes. They just walk in. We are in the hospital. We can't call them, you come at this time or you come at that time. Doctors send us the patient and they want report there and then. So if we send them back, the patients don't like it. So we have to see all those patients, routine patients, whatever come into our clinic. We just take a proper history. We take a proper history, and if we suspect anything, or if it's emergency from ER they have come, we keep them in a separate room. And the routine patients in a separate routine room where we do the ultrasound normally. Because when we say that you come later on, they say you go to the hospital. They say no, we don't want. We are healthy people. We don't want to go to the places where the patients are sick. So we have to take them. And now, as far as the main, I'm concerned about talking of the ultrasound machine. So, and how close we are with the patients. Patient is lying in the bed over here, and we are just standing in front of the machine or sitting, and we are so close that even if we stretch hand to 2 foot se zyada fasla hum nahi kar sakte. So they are very close. So, as Dr. Mussarat said, that they should be masked and they should have gloves, because they are so close to the side of the machine. And when sometimes when they want to get up, they put that pressure on the machine. So they hold the machine. So you have to clean the machine completely. When the patient leaves, we have to clean the side of the machine. Normally it should be done at this dashboard. This should be cleaned. The whole machine should be cleaned daily, and detail should be done once a week. Then wires should be cleaned. The main thing is probes. These are two abdominal probes are there, and this is the transvaginal probe. These abdominal probes needs low level of disinfection. After every patient, this is normally done. This should be normally done. Whatever we are doing now, we are a bit more extra careful. But this is routine. This should be done routinely. That after every patient, these probes should be cleaned, and then after damp cloth, it should be cleaned for the next patient. But as far as the transvaginal probe is concerned, it needs meticulous cleaning. It needs deep, high level of disinfection, and what we are doing, we do normally also still, but at this time of pandemic, we have to be very, very careful that it should be cleaned daily. And before starting this work in the morning, the probe should be disconnected, and it should be cleaned under running tap water with soap clearly. And there are some grooves here in the probe, and these grooves are for the attachment for the international procedure. These grooves should be cleaned very clearly. If you just wash it and just clean it with the cloth, it will not reach the hair. So we need a soft brush to clean this area. Now, after this cleaning the probe, washing the probe and this cleaning it, we cover it. Should be covered. Every transvaginal probe should be covered with a sterile probe cover, and while we are doing, we should wear half sleeve shirts so that afterwards we can wash our hands up to the elbows. And after the examination, after ultrasound, the cover should be taken off very slowly and clearly, so that the secretions of the patient should not touch the probe. And after removing the sheet, the probe can be cleaned with antiseptic solutions and disinfectants. Normally we used to have two bottles also. One bottle with a drop of this concentrated disinfectant solution, and then fluid, and this is clear water. So we use, just after the examination, we have to put the probe in this and in this. But these days, because coronavirus is sensitive to soap, we are using Dettol soap also, liquid soap, adding in it, so that coronavirus, if it's there, it should be destroyed. We can keep this because this has small opening, so you can keep it for a while. We can leave it over here, and after take out the probe and clean it, and then put it in the container with the water, clear water. There's several disinfectants available, sometimes spray, sometimes fluid, sometimes in a concentrated form, and unfortunately we have to use whatever is available in the market, and we have to take recommendation from the manufacturers also. Sometimes we have to be, when we suspect, and that separate room which is we have made for the suspected patients after taking the prolonged history, then we have to cover ourselves completely so that we can protect ourselves, and actually the patient is also covered. But see how close we are to the machine and in proximity. Thank you. Thank you very much.
Thank you, Dr. Tanveer, for a very nice presentation. And I will now request if there are any questions, we will be taking them. But in the meantime, I know that Dr. Mussarat had some slides to show, and perhaps he could share them with us, some visuals of what he was trying to tell us.
Thank you very much, Dr. Sadia. Since I was going live at that time, I just wanted to show you this particular disinfectant and the sanitizer which we use, which is made in Parker's laboratory in the United States. And if I can go to the next slide, it says that it kills 99.9% of bacteria in just 15 seconds. And this is also good for associated coronavirus and influenza and other things, which you can see on that screen. Now, coming to the next slide, we have got the total alcohol solution, which is the best solution, which is called as transseptic cleansing solution for ultrasound and transducer. We are using this, especially when we are doing any procedure. We spray this on the probe, and that is sufficient because this is total alcohol. And then we are using very high quality sanitizers as well. Now, people ask that, can we put the gloves over the probe and like plastic gloves and so on and so forth? And the answer is yes, they can do that. But if they have the specific, which I get it from America. In fact, I have got my stock for almost 2 years. And this is the best to do. And in fact, the best quality gel, which I mentioned, was also important because that itself has alcohol content. So when you wipe the probe, and it cleans automatically. Thank you very much, Dr. Sadia. Over to you.
Thank you, Dr. Mussarat. Yes, Dr. Shama, you wanted to say something?
Yes, I just wanted to add something, that we all think that corona is the end of this world. But if you look at the bacteria, I can't share a slide with you where you see that the bacterial spores are the most resistant on the probes, and the COVID or any virus is much more susceptible. So, you know, it's not that bad, and we should hang in there.
Thank you for pointing that out. And we shouldn't forget tuberculosis, which is still present in our population. So, and this coronavirus is like other viruses, very fragile and can be killed easily using the right solutions, as our eminent panelists have pointed out. Now, being an obstetrician and gynecologist myself, from your presentations, all of you, I have gauged that we might be putting your lives at risk when we send unnecessary ultrasounds to you. So both in gynecology and in obstetrics. So I will request Shama for you to recap that about minimizing obstetric ultrasounds, and I will request Dr. Shahida also to recap the minimum number of gynae ultrasounds which we really need to do in the next month or so, because the next couple of months are very crucial for us. And our patients are not going away. We are, as healthcare providers in both ultrasound specialty and obstetrics gynecology, we have to keep working. You know, all of us cannot stop working, and we have to provide these emergency services. So at the same time, we need to protect ourselves very carefully as well. So Shama, would you like to recap as well the indications?
Okay,
minimizing obstetrics.
Yeah, I think what we need to do in this pandemic is to concentrate on the anomaly scans more, and the growth scans are the last on our priority. Nuchal translucency in a nutshell for those that are at high risk. In simple, short and simple. But like the guidelines are already there, but there are other things that you can reduce the risk of exposure is to take the video clips and then work out the measurements and everything for anomaly scan offline, counseling offline, on the or by teleclinics, because हम जितनी भी counseling मैं करती हूँ invasives की, मैं beforehand I do a teleclinic, I tell them the risk of miscarriage, everything, and then I kind of deal with that. तो basically हम जितना भी minimize करेंगे risk, वो हमारा यही है कि हमारा room जो है prepared होता है, हम कम काम करते हैं, जो indicated scan होते हैं वही करते हैं. Anomaly scan सबकी जरूरत है, तो अनोमली स्कैन, लेकिन अनोमली स्कैन का विंडो पीरियड जाता है 18 to 23 वीक्स, अब 22 कह लें क्योंकि हमारे यहाँ टर्मिनेशन के मसाइल होते हैं, तो लेकिन हमारे पास 3-4 हफ्ते का टाइम होता है. ग्रोथ स्कैन जो है ना, वो बहुत ज्यादा इमरजेंसी नहीं है. Like I have cut down all my routine twins and everything, so I think anomaly for everyone, NT for selected patients, growth seldom. That's the nutshell. Plus the thing is that if you take video clips and everything, it will be much better.
Okay, thank you, Shama. So we have other questions coming, and maybe Dr. Mussarat can answer. So can we cover the probe with a disposable plastic sheet or a glove? I think Dr. Tanveer already mentioned. And the best gel can you to use?
Okay. Thank you very much, Dr. Sadia. I think, all right. One thing which I wanted to add that routinely during this COVID-19, apart from doing obstetrics and gynecological study, we are also doing the subphrenic areas, that is the lungs on both sides. And we are looking at A lines and B lines, and also pinpointing if there's any pleural effusion, consolidation, pneumonia, and so on and so forth. Of course, that's not very specific, but by the comet tail artifacts above the diaphragm, we get suspicious about that something may be happening in the chest, and we advise chest X-ray. As regarding the gel, the best gel is Aquasonic Parker's gel, and which comes in blue and transparent color. And that is one of the best gel which I've been using for last 37 years at my clinic. I don't use any other gel because it has got a lot of alcohol content and it evaporates from the patient. It doesn't cause any irritation, and it is very easily cleaned. And that is the best gel for the probe as well, because if you use any other disinfectant on the probe, it can swell the linings of the probe and that can damage the probe. So ideally use the best gel, and ideally use Protex, which I just showed you the pictures, that it kills almost 99.9% of germs, and especially for the SARS and coronavirus. That is wonderful. Thank you very much.
But is it freely available in Pakistan, and the cost? You see, all these things come into play.
I know that it is costly, number one, but when you have to do the high quality work at your center, you don't care about that cost. Like for example, a 5-liter pack will cost you about 3,000 rupees, and the ordinary gel will cost you about 600 or 700 rupees. So this is the cost difference. It is available once you order it, but we don't know that the supplies is still possible, because the international trade is almost at standstill. So we got our stock almost for 2 years with us. Thank you.
Thank you, Dr. Mussarat. Yes, Dr. Shama?
I just wanted to add something, because there's something that we haven't talked about is PPE. Because I think I see a lot of photos. Okay, भाई हम क्लिनिक कर रहे हैं, हम PPE में कर रहे हैं, हमने गाउन पहना हुआ है. तो मेरा ख्याल है कि सबको जो है ना, सामीन और हाजिरीन को ये पता होना चाहिए कि अल्ट्रासाउंड के लिए PPE की जरूरत नहीं है, बशर्ते कि आपको पता है कि मरीज को कोविड-19 का पेशेंट नहीं है. देन यू गो. नॉर्मली आप जो है सर्जिकल मास्क पहन सकते हैं. अगर if you have N95, that's fine, but if you don't, then you wear simple surgical mask, you wear gloves, You don't need to wear gown, as Dr. Tanveer has already said. लेकिन आप disposable gown पहनेंगे, उनका जिनका लंबा चौड़ा आपको procedure करना है, और PPE की सिर्फ उस वक्त जरूरत है जिस वक्त आप कोई लंबा चौड़ा procedure कर रहे हैं और जिसमें suspicion है आपके पास. So don't panic.
Yeah, so I think if the person who's operating the machine is the sonographer is wearing even a plastic gown, perhaps a disposable Macintosh kind of disposable plastic gown, and wearing eye protection as well. So I think that is something. You don't need the full PPE hazmat kind of suit. And I would like to reiterate that, because a lot of doctors in clinical situations, which is not just the ultrasound, it's like an OPD in a routine gynae clinic, are unfortunately sharing selfies in these expensive suits, which is not required. And as Dr. Mussarat, Dr. Tanveer, you and Dr. Shahida, you've all stressed on that, either gloves or hand washing, 20-second hand washing in between clients or patients is the most important thing, step to follow. So I will ask, yes.
Dr. Shahida and Dr. Shama Munim talked about obstetrics and gynecology. When we talk about the emergency ultrasound, it also includes the DVT-like situation, the swelling in the legs, which cannot be postponed at a later stage. Sometimes there are clots. So any interstitial edema in the leg and the groin should also be taken into consideration apart from the pregnancies. And when we talk of pregnancies, there are some associated problems like diabetes and hypertension. Those patients require meticulous ultrasound and frequent ultrasound with color Doppler and ductus venosus and MCA. So they cannot be deferred. So we can include that as well. And of course, the torsion of the ovary and the torsion of the cyst and appendicitis, which comes into the lower abdomen, should also not be neglected. So any patient complaining of abdominal distension, whether if it's of acute nature, that should be taken into consideration right away.
Yes, thank you, Dr. Mussarat. I think Dr. Shahida did mention the torsion of the ovaries, and I will go back to her to recap and give us in a nutshell, and I will again like to stress here that we clinicians who are referring patients to sonographers, and by sending unnecessary ultrasounds, we are putting their lives at risk as well. So I will request my community of clinicians to keep you all safe as well. Yes, Dr. Shahida.
All right. I'll just mention or touch upon the indications for a gynecological scan, which has to be conducted without delay. And as I mentioned earlier, patients who have persistent pelvic pain and are suspected to have one of those conditions that I mentioned, or is accompanied by a pelvic mass or an abdominopelvic mass, they need to be looked at urgently. Then patients who have developed complication after a procedure or a surgical operation, they should naturally be looked at so that any dire consequences of the procedure can be excluded. And then we mentioned that if the patient has heavy vaginal bleeding, especially if it's accompanied by conditions such as anemia, then they should be looked at urgently. And I would include that postmenopausal patients who are bleeding should also be looked at, should also have an urgent ultrasound performed in order to exclude a possible malignancy. The rest of the patients can be deferred either for a few weeks or, in fact, even after a pandemic, after the pandemic is over.
Thank you, Dr. Shahida. I would like, I mean, we're coming towards the end of our session, so I would like each panelist to give their a one or two liner about anything they would like to add. So I will start with Dr. Tanveer Zubairi to say a few words. Any particular message you would like to give?
I was the same message you were saying that you all should send the patient only emergency, because we cannot refuse the patient. They start fighting and they start saying that we have got pain. I mean, when they start complaining, how can we send them back? So we have to take them. So it's better that you all should take this part. Can you please try to as much burden on us at this time?
Thank you, Dr. Tanveer. Dr. Mussarat.
Yeah, one thing which I want to add is that sometimes the patient comes with children, and we should avoid children in the clinic. And we always tell them that please keep your children away with the other patients, because no one knows that what is going to happen. And in the concluding remarks, I would just say that give to the world the best you have, and the best will come back to you. By giving service to humanity, we are helping ourselves, and we are helping the nation, and we are helping the patients. Thank you very much.
Thank you. Dr. Shama?
Actually, I want to clarify something that when I said growth scans can be delayed, I meant that routine scanning for diabetes who are well controlled can be postponed. And I think I did mention that they have to be tailor-made. So if somebody has IUGR or fetal growth restriction, उसका तो जाहिर है स्कैन होना है, लेकिन जो रूटीन 3-4 हफ्ते में बुलाते रहते हैं उसको आपको थोड़ा सा अवॉइड करना पड़ेगा इस पीरियड में। दूसरी जो चीज थी वो 2 क्वेरीज आई थी मेरे लिए, उनको मैं एड्रेस करना चाहती हूँ। किसी ने पूछा था कि NIPT क्या है। मैं माय अपॉलॉजीज, इट मींस नॉन इन्वेसिव प्रीनेटल टेस्टिंग। इट्स अ ब्लड टेस्ट which is done in the first trimester, and many people use it if you can't have the access टू न्यूकल ट्रांसल्यूसेंसी, क्योंकि वो ब्लड टेस्ट होता है और वो हो जाता है। उसके प्रोज एंड कॉन्स हैं जो इस सेशन की डोमेन से बाहर है। लिहाजा हमने तो इसलिए मेंशन किया था कि बजाय मरीज आपके यूनिट में आए और आपको उस पर शक हो कि वो इस पीरियड से गुजर रहे हैं या सिम्टोमेटिक हैं, तो उनके लिए कोई चीज तो होनी चाहिए। अगर एंटी नहीं कर सकते तो आप ब्लड टेस्ट तो कर सकते हैं, और उसका डाउन साइड सिर्फ इतना है कि उसकी कॉस्ट ज्यादा है। दूसरी जो चीज है वो somebody asked me about the PPE के PPE जो है ना कौन सा इस्तेमाल करना है। Can I just quickly show? Can you share the screen please? That ये जो
So you, Shama, you can look for that picture while I'll take the concluding. Okay, you got it?
I got the picture.
Okay.
And somebody was asking me how they do things for the deliveries and stuff, and these are the 2 guidelines for the UK and USA, that vaginal delivery you need proper gowning, gloving, aprons, fluid resistant surgical mask, and same as US, where US recommends for respirator or N95 mask. And for urgent cesarean section where you don't know the status of the patient, then you would need PPE with FFP3 mask also. And you have to prioritize in terms of USA. And
Okay.
non-urgent is different.
Okay, thank you, Shama. So I will just add there that, yeah, everyone doesn't have to wear the whole, the suit and everything. And the aerosol generating procedures are the ones which put us at risk. And these are for the anesthetist, the intubations, general anesthesia, and similarly for the gynecologist. So general anesthesia is to be avoided. But for our routine non-COVID labor cases, this is standard infection prevention guidelines. It's no big deal. So you don't have to be in this plastic suit all the time to deal with normal laboring women or a C-section under spinal anesthesia. So, Dr. Shahida, would you like to conclude, give your concluding remarks?
I would just make just a brief statement both to the gynecologist and to the ultrasonologist, echoing actually what you have already mentioned, that before you send a patient for a gynecological scan and before we scan a patient for gynecological indications, it's important to weigh the risk-benefit ratio. Is our scan in these times of crisis going to help in the management of the patient or not? If it's not going to help us in the immediate future in the management of the patient, then we should consider not sending the patient or not scanning the patient. So that's it.
Thank you, Dr. Shahida, for concluding it very nicely. And I would like to thank all the panelists. Yeah, you are really the most eminent sonographers and radiologists of our country, and providing this service in this time is commendable. And keeping in mind that we're all putting our own lives at risk by providing this service, we must keep ourselves safe and our families safe as well. So thank you so much for this timely guidance. And I will request I will request my own fraternity of obstetricians and gynecologists to please limit your ultrasound scan requests. Thank you very much. And thank you, Getz, for hosting this. Without your expertise, we would not have been possible for SOGP to do this on our own. Thank you very much. Khuda Hafiz.
Thank you.